Hi, Dr. Brahenna again. This is part of our series on AskTheDentist.com about just explaining basic dental procedures and what to expect when you go in. And it may sound kind of basic, but sometimes I think things aren't explained well enough and your expectations are low and they should be higher. So let's talk about a cleaning. Just a basic regular cleaning on a healthy patient every 6 months preferably. That keeps your C-reactive protein reading down. That's a measurement of your inflammatory index, how inflamed your body is. That's one of the ways you can keep that down, by keeping your teeth clean. Gingivitis leads to, as we all read now, heart disease and other diseases. It can irritate your diabetes, can upset your blood sugar regulation and all that. So anyway, we've established that regular cleanings are very, very important. But what should a regular cleaning be? A regular cleaning should take an hour and arrive on time. That's important because your hygienist has another patient the following hour, and if you arrive late, then you're not going to get the full benefit of her time or his time. So a lot of cleanings are done in 20 minutes with an ultrasonic scaler, and you're in and out, and that's not a real good cleaning. It takes an hour. It's a combination of using the ultrasonic, that little machine that makes a buzzing noise. That's for gross removal of tartar. They have new thinner tips that are very efficient and work very, very well and allow us access to areas that we weren't able to clean before. And then some hand scaling with, that's the old-fashioned way of cleaning, but that's still important. Carbon steel instruments that are sharpened. Hopefully your hygienist is sharpening them often. When they're autoclaved, they get dull and they don't really remove tartar. They can just burnish a tooth instead of removing tartar. So ask your hygienist, when was the last time you sharpened her instruments? That'll throw her off guard a little bit. Ask your dentist too. But it's information that you should know about, and you should get an answer on that. Instruments should be sharpened at least once a day. The visit should take an hour. Greeting, sit down, a review of health history. Has anything changed in your health history? And then the cleaning. At the end of the cleaning, at least 10 minutes of education, talking about where you can improve things, visual demonstration of what to do in your mouth. That doesn't get done often enough. We have a video on how to brush and not overbrush. That's the job of the hygienist, and without the hygienist, dentistry would be far behind where it is now. Hygienists are an important part of the dental team. So the other 50 minutes of the visit, or 40 minutes of the visit, is sitting down and cleaning tooth by tooth. And there may be a running dialogue, like this area needs a little work. You can be holding a mirror at the time. You hold the mirror up at a moment's notice, and where she can point something out to you. And it's good to familiarize yourself with the problem areas and see them, visualize them. And your hygienist should be giving you kind of a running dialogue on these areas. And each 6-month period may be a little different. There may be improvement. There's some seasonal differences, like during winter, people are mouth breathing, and the front teeth may have some gingivitis. Then the dentist comes in and does an exam. That's at the end of the visit. Sometimes it could be at the beginning. It depends on the timing, and that's fine. And again, that should be kind of a quick checkup, but it should also be discussion about things like sleep apnea, dental habits or lifestyle habits that may affect your teeth, what you're eating. And that should be pretty comprehensive. But again, I think the take-home message here is that you should expect 1 hour, a full hour, assuming you arrive on time, a full hour of that hygienist time. That's important. Too many cleanings with HMO, PPO, large clinics, whatever. I don't want to upset anyone, but 20, 30, 40-minute cleanings are not enough. It should be 1 hour, and that's what you deserve.